sample days. Here you can see the lens and vitreous body. And here you can see one more time, the magnified image. And you can see that this is a vitreous body and this is a lens. So you have lens, right? And from the beginning of the 12 weeks and the middle of the 12 weeks and 13 weeks of gestation, like this, by silhouette ultrasound, you can see the eyeball is developing like this in the first trimester. And this is the 19 weeks of gestation, the eyeball. And here you can see, okay, so this is the eye. And here you can see this is the lens. And there is some string right here. And this is the central canal. And here this is the vitreous body and lens at 19 weeks of gestation. And here you can see this is the lens and vitreous body and the central canal. Right? Now, this is the fetal face. You can see the lips and the nostril. And then, if you look at this face with silhouette ultrasound, here bilateral vitreous body with lens here. And then, if you look at the axial section of the eye, you can see the eyeballs here and the lens here and the central canal here. Okay, so if you look at sorry, please to put off your mobile phone. And if we use the silhouette ultrasound, here you can see. So this is the bilateral, the eyeballs with lens, and then from the side, lateral view of the vitreous body is like this. Okay, so this is the vitreous body, and this is a lens, and this is by the ultrasound. But this is not the new one. The new images, those are in the 2014 or 15. So this is a 10 years old. But this is one of the sonography technology. And then here you can see this is the eyeball, and then sometimes the eye lens. Here this is the normal location of the lens, but here you can see this is a transient exotropia in the case of the severe hydrocephalus. This is like this. The bilateral, the eye, the location, the lens location is laterally, and then here this is the holoprosencephaly, and maybe many of you you are aware that holoprosencephaly has a facial abnormality, and facial abnormality sometimes that it is today Tom showed the very the facial abnormality with holoprosencephaly with the cyclopia and the proboscis and sometimes the one nostril, not the two nostril, and sometimes the curved lip and palate. But regarding the eyes, if you think that this is cyclops means one eye. However, inside of the eye, sometimes like this, right? You can see that there are two eyes inside of the one opening. And if you look at this, that this is a fuse by two eyes, but the two eyes, but the opening is one. this was happening, and here this is a very abnormal baby with a holoprosencephaly, and then here you can see that there's an opening is one, but the two eyes, two lenses are attached together. Okay, and the other example, this one is also very similar. And this is a proboscis, and you can see the one opening of the eye. However, this is the two eye lenses here. So therefore, that this is not exactly strictly speaking, this is not the cyclops. That this is the two eyes together, the fused inside of the one eye. Now, sometimes that you see the exophthalmos. This is also the very, very much associated with the brain abnormality. And in some of the holoprosencephaly case, that you can see the exophthalmos. The exophthalmos, the eyeball is over protruded. In the bilaterally, and here this is the 29 weeks of gestation. This is a case of exophthalmos. Sometimes the normal people have the exophthalmos, so you don't say that the exophthalmos is maybe the abnormality or abnormal brain structure or something like that. Now this is another one. This is a normal face, and then here you can see this is a microphthalmia. Microphthalmia means the small eyeballs, and this is at 12 weeks in the case of trisomy 13. Okay? So the many of the eyeball, the exophthalmos or microphthalmia, and the other abnormal, the eye abnormality are associated with abnormal brain structure. Now, how about this? This is the normal one, normal lens, and then here you can see this is the fetal cataract. Okay, so this is at 19 weeks of gestation. And this one is a 14 weeks of gestation. This is a congenital cataract bilaterally. The bilaterally, and then this is this baby has a holoprosencephaly. And the other one, this is the case of Turner syndrome. There was at this point, at 19 weeks of gestation, there was nothing normal in the brain. However, this baby has a cataract bilateral. Now, what is this? This is a 20 weeks of gestation. Here, you can see. Can you see cataract? No. Over time? What is this? What? What did you see? Hemorrhage. Where? So, what is this? This is lens, right? But what is this membranes? This is the membranes inside of the eye, right? What is this? One more video. So eyeball is the eye movement is seen, but what is this? There's the membranes here. What do you say that the membranes inside of the hyarid artery, the eyeballs? Here you can see this one. This is a tomographic ultrasound imaging, and here there's a completely abnormal, right? The other one is normal, but this eye is completely abnormal. So what we call is the retinal detachment. Here you can see the retinal detachment. And this is silhouette ultrasound. And one eye is okay, left eye is okay, and right eye there's a retinal detachment in utero. This is very, very abnormal and very rare occasion. Now, the last three, the hyarid artery, this is the hyarid artery, this one. And hyarid artery, but most of the pediatricians, they don't know hyarid artery. Why? Because hyarid artery disappear at the age of around 30 weeks of gestation. Okay, so the 97% of the mature infants, no remnant of the hyarid artery is visible. Okay? Now, the hyarid artery is the artery from here to the back of the lens. Okay? So here you can see this is a very hyarid artery at 18 weeks of gestation. You can see that, right? And then by 3D ultrasound, you can see that this is the hyarid artery at 19 weeks of gestation. And here you can see this is the hyarid artery. Now, here, this is a 20 weeks, and bilateral hyarid artery is visible. Can you see that? Right? Actually, this is a transvaginal ultrasound. So, of course, that this is very visible. And then, now, this is 20 weeks. And how about, 13 weeks in the first trimester? Is there any hyarid artery there? Yes. Here you can see. This is the hyarid artery bilateral. Okay, bilateral. There is the bilateral lens, and then behind the lens, you can see the hyarid artery bilateral. Okay, so this is normal, and then if I put the lens here. You can see the bilateral, here you can see the bilateral hyarid artery in the first trimester. Okay, so it means like this, the lens is here, hyarid is there, and hyarid artery is in the middle, along with the hyarid, the central canal. Okay, so now the holoprosencephaly, the transmit 13 case. Holoprosencephaly, as I told you, the holoid plexus is from left side to right side. And then, are they normal or abnormal hyarid artery? Here is transmit 13, and I think here you can see this is the lens. This is the lens. However, this is a normal, and I look at the many of the transmit 21 and 18, and they were like a normal structure of the hyarid artery. But transmit 13 with a hypoteres, that they are sometimes they are the eye attached together, but sometimes that they are approaching too much approaching. And that is called hypoterism. And hypoterism, the hyarid artery has made a mistake to attach the not the center of the lens, but the edge of the lens. Okay, so this is a malposition of the hero. Now, the almost the last, this is the case, opera, anomaly, and the genetics. Here, this is the case. At 18 weeks of gestation, the small newborn and micronasia, low year ventriculomegaly. Here you can see this is a ventriculomegaly and subventriculomegaly, and also there's the congenital heart disease. This is the most probably the DORV plus the mitral stenosis, and the double kidney and genetic disorder was strongly suspected. Alright? And here you can see this is a very abnormal face. Can you see that? This is a very abnormal face, like this. Okay? And how abnormal, I will explain about this. Usually the embryonal eye development, as I told you, eye is created, the bilateral eyes are created in the side of the face, and then they are approaching each other. However, here you can see this is this is the first stage. The eye is here, right? They're very far away each other, and they are approaching like this, and finally this location of their eyes. Alright? And usually, as I told you, at 18 weeks of gestation, normal eyes, this is the hyaroid and lens, and then this is the eye sockets of the how to say, this is the bony structure, and you can see this is the hole for the eyeballs, and it is called eye socket. Okay, so those are the mesomorphs, and then here those are the eye socket, and normally the hyperterorism is the two eyes apart each other, and this is a normal, and this is a hyperterorism. Some of you have the hyperterorism, right? But hyperterorism, sometimes that this is at the same level, at the same height, the eye is apart each other. That is called hyperterorism. And this case is a bit different. This is the case, this is the case of the hyperterorism. Usually, it should be here, right? The eyes should be here, but that is here, not in the same level. That is apart and lower part, right? So this is completely abnormal, and the eye socket, the location of eye socket is completely abnormal compared to the normal case. Now, this is the case, after the abortion, after the termination of the pregnancy, and here you can see this is a completely abnormal location. And what was that? That this was a de novo CDH2 cadherin 2 mutation. This is gene variant caused a genesis of the corpus callosum and cardiac. This case had the cardiac abnormality and ocular and genital syndromes. So this case was the brain abnormality and heart abnormality and ocular abnormality, in this case. So this is the end of my today's lecture, and this is the last slide. And And thank you very much for your cooperation.